Cardiac disease in the United States is the classic example of why we have to look at things with a sex and gender lens. 1985 is the year that I graduated medical school, and that's the year that the lines crossed for when more women died of heart disease in the United States than men. We always thought that heart disease was a man's disease, so how could more women be dying every year? So rethinking everything about our approach allowed us to improve the health of women. And if that's true for heart disease, why not GI diseases? Why not brain diseases? Because the truth is, it's all different.
Welcome to 20-Minute Health Talk. I'm your host, Rob Hoyle, and today's special guest is Dr. Stacy Rosen. She's the Senior Vice President for Women's Health at the Katz Institute for Women's Health and Partners Council Professor of Women's Health at the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. Dr. Rosen, thank you so much for joining us on 20-Minute Health Talk. It's March, it's Women's History Month, and we're talking about an exciting new initiative called Raise Health at Northwell Health, really to empower women. Tell us a little bit about this campaign.
Yeah, no, it's our new Northwell campaign, and it's truly a rallying cry for our community, and particularly our women, to improve their own health. Northwell knows better than anyone that what goes on in your doctor's office, in our hospitals, in our emergency department, is only a small percentage of how you stay healthy as an individual. And if you and we get out into our communities and really take care of the holistic needs of our patients, we know the communities will do better. The Raise Health for women is the fact that 51% of our population is female, yet women have been understudied, underrepresented in trials, misdiagnosed for decades. And so the Raise Health for Women's Health at Katz is really our igniting a movement to really see women's health differently.
Yeah, I think what's so great, there's an ad for
fabulous.
Yeah, and it shows a woman breaking the mold.
Absolutely. As they say, every cell in your body has a sex, not just the parts covered by a bikini. And, historically, the model for healthcare, for research, for clinical practice has always been man. And the assumption was that women were the same, except for those pesky hormones, as we joke. But the truth is, when we practiced that way, when we did research that way, women didn't do as well. Their outcomes were poorer. And we had to sort of rethink the entire assumption that men and women are the same.
Yeah, and you're a cardiologist. So obviously you saw a big discrepancy. There were a lot more women dying from heart problems than there were men.
Yeah, that's actually cardiac disease in the United States is the classic example of why we have to look at things with a sex and gender lens. 1985 is the year that I graduated medical school, and that's the year that the lines crossed for when more women died of heart disease in the United States than men. And the death rates for women continued to rise and rise and rise for the next 25 years, despite all these great advances in cardiac health. Men actually started to die at slower rates. So we realized that this couldn't be one size fits all. And ironically, we always thought that heart disease was a man's disease. So how could more women be dying every year? So rethinking everything about our approach allowed us to improve the health of women. And if that's true for heart disease, why not GI diseases? Why not orthopedic diseases? Why not brain diseases? Because the truth is, it's all different.
Yeah. A few months back, I was lucky enough to be a part of, I watched this ceremony, the white coat ceremony. Tell us a little bit about the white coat ceremony and what it means.
No, it was a really spectacular day for us and really aligning the Katz Institute as a formal institute at Northwell, as Dean Smith says to me, is a really big deal. So we all know what a surgeon is, what a cardiologist is, but what is a women's health expert? Historically, it was our gynecology friends and maybe our breast doctors. But the truth is, at Northwell, we've got extraordinary expertise in women's sports medicine, in women's liver diseases, in migraine, in women's heart, and go on and on and on. So this is a formal process where scientists, doctors, as well as other allied health professionals, nurse practitioners, PAs, therapists, can apply to become members of the Institute. And on that day, we had a ceremony with Dean Smith, Mark Salazzo, that we put the white coat on with our beautiful logo, our beautiful service mark, to really kind of be a shout out to our patients and other referrals that this is a special group.
Yeah. And this is Women's History Month, like we said. So it's so great to raise awareness. And I think that one thing that you've always talked about is that women, for the most part, are the chief medical officer in the family. They're really concerned about making sure everybody else is okay and healthy, but often they don't really, they put themselves last.
Yeah, absolutely. And that's where gender comes in, how women are perceived and relate in society. So most of the medical decisions in families are made by women, 80 to 90%, yet women will always put their family's needs first. And that's been particularly bothersome during the last COVID year, when women are often missing their preventive health visits, taking care of themselves last, potentially not feeling well and still not feeling empowered to advocate for themselves, to take better care of themselves.
Yeah. And so this is the Katz Women's Institute for Health. Tell us a little bit about who Iris and Saul Katz are and what is their mission.
So they tell an amazing story. They are truly revolutionizing how women's health is perceived. Iris told me the story that years ago, and it's a cardiac story, there was science that showed that men should take a baby aspirin a day. And the two of them were using the same internist, and the physician told Saul to start taking a baby aspirin. It'll prevent the first heart attack and stroke. And Iris wisely said, well, what about me? And the doctor correctly says, well, we didn't study any women.
Wow.
And that was unacceptable to her, of course, as was the idea that not all women should get the same care as she does, being someone who's so aligned with our health system. So they, before I even joined the Institute, had this vision of truly aligning women's health needs around the patient, not around the way doctors work, being sure that women were uniquely studied and treated as, separate from men, and also to be sure that we were out in our communities, educating, advocating for all women that Northwell serves.
I'm not sure if you said this, but I think I remember hearing somebody say this once before, is that people kind of, when they get into relationships, they don't want to leave that relationship. And sometimes when people aren't happy with a doctor or a nurse, sometimes they just stick with it because they don't really know how to maybe, break up with their doctor. But what would your advice be to women who aren't feeling like they're getting the best care they can from their healthcare provider?
No, that's a really important question, because we talk a lot about how to be a good patient, and that includes self-advocacy. So firstly, we teach all women in Katz, we do a tremendous amount of community education, how to be a good patient. So keep your own records. We joke you would never show up to your accountant, it's almost April, right, without having all your paperwork. So, own your records. Do your homework about the kind of doctor you'd like to go to. Come prepared with questions. Maybe bring someone else with you. And if you feel that you're not being heard, we use the term gaslighting. If you feel you're not being heard by your doctor, find someone else or let them know that this isn't working for you. We joke that women would fire a hairdresser, with one haircut, yet they will continue to go to a doctor who really doesn't understand their unique needs. And I think your relationship with your doctor over a lifetime is one of the most important relationships you'll have.
Yeah, I think that's so true. When people go to the doctor's office or go to an emergency room, they're nervous. They want to be told everything is okay. So I guess it could be difficult for people. What would your advice be for somebody who knows that maybe something's not right? How do you say that to somebody or a clinician to say, hey, I don't know everything about medicine, but maybe you can do this or that, or what would be the best route when you think something's not right?
Yeah. So I give two suggestions. First, what would you do if you were the parent of that person or the spouse or the friend of that person and you were watching an interaction and you didn't like the outcome? It's so much easier to advocate for somebody else.
Sure.
So think of that voice that the questions you would ask, how you would respond, and do that for yourself. The second thing is I tell people to practice as if they were ordering a coffee at a coffee place. No drama, no, I'll take a latte with no sugar. Doctor, I don't really think I understand what you're saying to me. Could you repeat it? I don't really think that you're hearing my complaints and my cardiac history, or my diarrhea has not gone away. Can we discuss it a little further?
Yeah, I think that's a great point, because I think sometimes, in no fault of a doctor, right, or a clinician, but sometimes they just assume
Absolutely.
That somebody's going to understand because they come from this medical. It's almost like a different language. So I guess there's no harm in saying, can you tell me that in lay terms? Or
Absolutely.
Right.
And that's a great point, Rob, because we also now need to teach our clinicians and our doctors, scientists, and other professionals about health literacy. I was taught, before we finish an exam, to say, "What questions do you have for me?" So that there's really an opportunity. Because even if you say something, "Do you have any questions?" the patients are nervous. "Oh, no, doctor, you look busy." So we have to be better attuned to the patient's needs, and this is how we train our medical students and our advanced, practice nursing students, et cetera.